Sounds good.
Hi, everyone. Welcome. Thank you so much for joining us on a late evening. We appreciate it. We are excited to have Dr. Moldovan in our office, and she can tell you what she does.
I'm so excited to be here. Hi, everyone. Daylight savings time is upon us.
That it is.
At the right time. We're here on a rainy day in LA. I just came from the office. We have biological 3 practices in the southern Los Angeles, Encino, Beverly Hills, and Newport Beach. And it is my passion to teach people about a natural way to a healthy mouth. And we were talking about this because a lot of people don't know what a biological periodontist is.
Please explain.
So what we do as biological dentists is that we help to detoxify the mouth from microbes and metals so you can have a healthier body, because your mouth is connected to the rest of your body.
Absolutely. And we in our practice at Sayana Medical see lots of women around the perimenopause, menopause age group. And for those of you who are wondering what that age group is, it's really above 35, all the way till your 60s, 70s, you're going through hormonal changes. So in this specific kind of category of decades for women, what do you see in their mouth that may be different than men, or different from kids, or different from women younger than 35?
I love that you jumped right into it, but as I'm sitting here, I'm like, how did we meet?
Oh,
I have to tell the story.
Okay, then go ahead.
Because we met really, why? Because we're both passionate about oral health, overall health, and how it's connected, and we have patients in common.
Yes, we do.
And I said, who is Dr. Sayana? Because she's really teaching the right things. And we're actually giving people some oral supplements.
Yes, we work. So much of the whole inflammation in the gut starts in the mouth.
Yeah, but it's not common for physicians to actually look in the mouth. Were you taught it in medical school?
Absolutely not. I think we were taught very little about nutrition and pretty much nothing about the mouth.
Yeah. So how did you learn to put supplements?
And then it was really going through my own kind of health journey and realizing that there's a root cause for everything.
Yeah.
And learning that the mouth is really part of the whole GI tract.
Yeah. So
and again, it's very unusual to have a dentist who's thinking about whole body inflammation and nutrition. How did you get into what you do?
So I actually went to the Institute of Functional Medicine.
Okay.
Which you went.
Yes.
And why? Because I was just interested. I studied nutrition. I was interested in how the whole body works, because I didn't know. I did the same procedure on 2 different people. Somebody healed great, and I get another person, and I'm like scratching my head. Why are they healing so poorly? So Institute of Functional Medicine has great courses teaching about inflammation and how the whole correlation. And I remember being in class in this lecture, and there was a physician there talking about chronic fatigue. And he put a slide up with a patient. My patient had chronic fatigue, inflammation, wasn't sleeping well, but we had to address the mouth, and there were cavitations in the mouth. And I just finished my residency at UCLA. I'm like, what in the world are cavitations?
Right.
I was not taught about
in your whole dental education.
No.
Wow. Yeah. So this is where my whole medical school education, I got 3 hours of nutrition training. I mean, that's like such a huge part of what I do now.
Yes.
But it's just very limited. Conventional, I think both dental and medical training is just very limited.
Yeah.
We're not seeing the whole person. Like, what are your genetics? How do you process fillings? How do you process your diet? How do you process your environment? How do you process stress? And how do you really treat for that?
Yeah.
And how do you make it personalized?
Yeah. So here I was in this lecture, and I'm like, what are cavitations? And he shows another patient with inflammation and brain fog. And it wasn't until they treated all the infected root canal teeth and got rid of cavitations that the patients were feeling better.
Yeah.
So then I started looking at this information. Okay, where can I learn about cavitations? And the one doctor that actually has the most experience and most published was in Switzerland.
Oh, and you went there?
I went there because, I didn't get married till late in life.
Yeah.
So I was able to do a lot of studying and research all over the world. So I went and spent some time with Dr. Volz. He had a course going on for 5 days, and I really got to see the live surgeries and the things that were coming out of the cavitations. Areas like all this toxic debris of microbes.
Wow. So do you see a difference? Like, you've been doing cavitation treatment for a while, where you treat the cavitation and you see the patient globally improve?
Yeah, the 2 main things is less brain fog,
Wow.
some more energy and clearer thinking. Those are the 2.
So what is a cavitation for people who don't know.
Yeah, good point. So that is a hole in the jawbone, just like a cavity is a hole in
Like
the
an
tooth.
actual hole.
It's a hole. So when we
Wow.
look, the way we diagnose it is on a CT scan.
Okay.
It's kind of a machine that wraps around the head.
Mhm.
20% of dentists have that in their office today. It's going to be, I believe, the standard of care at some point because
Hopefully.
the small little regular x-rays that most of you have seen at the dental office only diagnose about 52% of the problems.
Just half of them.
Yes, and that's been
Wow.
studied, scientifically proven, they don't show all the issues.
No, so it's not very reassuring.
No, 52% is nothing. That's why you might have gone to the dentist, you have a pain somewhere, and the dentist said, I don't see anything on your x-rays, because he probably doesn't. It's just not.
Just miss it
Not
half of the time,
Yeah.
50-50.
Yeah, exactly.
And then with the CT scan, how much can you capture? Many more problems.
Oh, yeah, so we can
Yeah.
see all the way the tooth structure, and they've gotten so clear nowadays, and
Wow.
crisp, and we can see even cavities, how deep they are, close to the nerve. We can see structures, measurements in millimeters, which are very accurate. The TMJ for people that are suffering from like TMJ pain and
Amazing.
migraine.
And is it toxic to get all these CAT scans, or how often do you recommend patients get
That's a
them?
great question. So now they're all digital.
Oh,
So you know, when you work in a hospital, you
Yeah.
send somebody for a CAT scan,
yeah,
it's a lot of radiation.
right.
But that was the old
Technology.
Oh, the new, especially the dental ones, they
Yeah.
only go really from like the this area right here.
Okay,
So we have
so it's very limited.
basically 2 days exposure of your iPhone.
Yeah,
That's what a CT scan in the dental office is.
that's pretty wild.
Yeah,
That's
so
it.
That's it. So if you put your cell phone away for a couple of days.
There you are. That's kind of hard.
It's all of us.
But that's
Sorry.
not much at all. That's great.
So
And you can tell you so much information. Why don't dentists do that? Like just for everyone?
Because of two reasons. Number one, CT scans, even though they've come down in price quite a bit,
Yeah.
it's probably like a third of the price that they used to be.
Okay.
I remember the first CT scans that we got when I was a resident at UCLA, which
Yeah.
was in 2002.
Yeah.
Those CT scans were around $300,000. So
Okay.
they've come and down in price a lot. Like for us, it's a standard of care. Anybody who's had missing teeth, root canals, or dropping TMJ, we need to take a 3D imaging, because if you can't see, you can't treat properly.
That makes complete sense. You know, before we kind of go on and talk about this in depth, I wanted to give everybody the opportunity to drop in chat any questions you really want us to address or things you're hoping to get out of this webinar so that we make sure we address it along the way. So I'll keep an eye on the chat and just let us know if there's specific questions you wanted us to address.
Yeah, we really want to make this webinar for you. I know some of you maybe have questions, Dr. Sayana and I have a great relationship over the years. We've treated a lot of patients in common for
And she happens to be my dentist.
Yes.
And so it's really important, I think, for a lot of our patients to really be like, well, what's happening in my mouth during this hormonal changes, and how is it different from just going to see a conventional dentist? What should they be looking for that are changes that are happening in their oral microbiome or in their gums or their teeth? That's important to think about during the specific phase of transition from perimenopause to menopause, as we all are guaranteed to go through that.
Yeah, so true. And actually, I'm turning 50 this year, so
happy birthday.
But I'm feeling some of these changes, and I'm seeing in my own tissues. And I invite all of you to actually do a little oral self-exam. It's not as hard as you might think. Basically, just kind of look in the mirror. You don't have to do it right now, but basically open wide and kind of pull your cheeks aside and look at the gums. Like, do you see a little yellow next to the gum? Are your gums receding a little bit? That's usually one of the things that happens in perimenopause and menopause, as our collagen thins out.
That makes sense.
The gums actually have a lot of estrogen receptors. Typically in pregnancy, we see a hypertrophy of the gums.
More gum tissue.
More gum tissue because of the increase in estrogen.
Makes sense.
But as the estrogen drops, we've seen thinning of the gums.
Wow. So what symptoms does somebody have? Like bleeding or just recession? Like how can they tell?
So sensitivity, that's number one. You can have a change in the microbiome. Like, for example, you can see maybe a more whitish tongue. So just stick your tongue out, kind of see what is your coating on the tongue. It should be like a nice white, like pink color,
color.
not white.
Right.
Typically, if you have a white coated tongue,
Yeah.
and a lot of you might think, well, I clean my tongue every day, which is awesome. But you know, it's interesting because my acupuncturist actually says that we shouldn't have to clean our tongues.
Oh, they should be always pink?
Yes, because if we eat enough fiber
That makes sense.
and sugar, it kind of cleanses itself.
Yeah, I would imagine the body's pretty amazing.
Yeah. And I
Okay.
notice this on myself too, you know, when I check in with my tongue, if I have like a low sugar or high fiber, my tongue is always pink. I don't need to brush it all that much.
That makes sense.
But more processed foods, more sugar, even if it's natural sugar, you'll see more of an overgrowth on your tongue. And an overgrowth of fungus, it could be candida,
Yeah.
or it could be bacterial.
Yeah, we see a lot of patients here because we are thinking about putting women on hormones or looking deeper for inflammation, and we do a lot of gut testing. And the biggest thing we always commonly find is SIBO, small intestinal bacterial overgrowth, high amounts of methane and hydrogen. And patients generally either say they bloated, or sometimes they say they have bad breath. And by treating the gut, we have improvements in the whole GI system.
Absolutely. So probably a lot of the patients that have the bloating have a white coated tongue.
I think they do.
Yeah, and we usually check this. Usually when I see people with white coated tongue, ask them, how is your digestion? Because usually there's always
There's a connection.
Yeah. And the thing is, a lot of people, I think that have bloating, they're so used to it. They're like,
Yes.
I'm just bloated.
That's so true.
Okay.
And yeah, a lot of times we ask questions like, oh, 50% of our patients we test for gut issues are like, I don't have any gut issues. And then when the tests come back and we're like, we see they're really inflamed or you have the wrong bacteria. And then they're like, well, now that I think about it, I think I do have some bloating.
Yeah.
Or I do avoid
Gotcha.
foods because it actually causes symptoms. But yeah, gut inflammation is so critical to even think about.
Yeah. And another thing that happens in perimenopause and menopause is something called a burning mouth syndrome. And I've actually experienced that.
Oh,
it's a
personally.
sensitivity, yeah, on the tip of the tongue, what almost feels like a burning sensation. When I look at it, it actually looks fine. And it's gone away.
Okay.
But what happens is, I have women at ages like mid-50s, 60, they come in, you know, my mouth is burning and everything I'm doing is just burning. And that's typically
That sounds
like
awful.
hormonal, yeah. And it's actually, they have this burning sensation.
Okay.
Some of them also report a Velcro like, you know, I feel like I have Velcro in my mouth.
Okay.
That has to do with the drying of the glands. So, and this could be a sign of autoimmune issue.
Yes.
Actually.
We have so much undiagnosed autoimmune disease. A lot of my patients are like, well, you know, nobody's ever looked deeper because I haven't either asked them to, or I haven't, you know, they haven't taken me seriously enough to look deeper. And
Yeah.
it's so important to ask your doctor, like, you know, is there do I have an autoimmune condition? Because perimenopause and menopause, your likelihood of getting an autoimmune disease is 4 times more likely than your previous decades. And yes, a lot of people complain of dry mouth as a person and probably come and see their dentist.
Yeah, absolutely. So I think this is one of the things that it's important to treat dry mouth, because dry mouth can lead to cavities. So you might see, and brittleness of teeth. And I think this, you know, I'm super passionate about this because we can prevent it with calcium hydroxyapatite tooth products. You'll notice, like, you know, the enamel of the teeth is starting to thin, and I'm noticing this on my 2 front teeth.
Oh, wow.
The edges of my teeth are becoming thinner.
Makes sense.
And as the mouth gets drier, we see more and more brittleness of the teeth, and the enamel becomes softer. The enamel is very much dependent on the saliva. The saliva mineralizes our teeth. So if there's not enough saliva there, now we get enamel doesn't have enough minerals.
So it's not as thick and sturdy.
Yes.
That makes sense.
And you can get minerals from the saliva. You can also apply minerals on the teeth, especially on saliva as well.
You guys have a product I've seen at your practice is it a powder? And what does it do?
Yeah, so my recommendation is a tooth powder. It's called Orasana. It has actually nano calcium hydroxyapatite, and we can drop a link in the chat.
Yeah.
And this one has probiotics as well, just to help. We know a lot about probiotics today.
How does it taste? A lot of my patients are always like, well, how does it taste?
Well, because I geared it towards women with dry mouth.
Yes.
I made it so that it's not super minty. When you have dry mouth, you cannot tolerate strong flavors.
Makes sense.
So this is more of an orange flavor. It has
How
a
often do you
tiny
use
bit
it?
of it. So we recommend people that have sensitivity to actually put it on their teeth with a toothbrush or with their finger and just leave it overnight. It could be a treatment as well, or it could be a toothpaste in itself, just as a tooth powder.
Just to put it overnight.
It's interesting because in the beginning, like 1950s, we had a lot of tooth powders, and then it kind of fell out of favor. We actually have a dental museum over in Washington, D.C. So I'm like, oh, look at all these tooth powders, and they have charcoal tooth powder back in the 1970s.
Charcoal. That's amazing.
And now it's a hot thing.
Yeah, now it's all toothpaste.
Yeah. But we didn't have calcium hydroxyapatite at the time. That's one thing we didn't have. They're mostly powders with calcium carbonate. And calcium carbonate is good, but it's not enough. You really need that calcium hydroxyapatite.
That's because that's the same kind of calcium we use for our female patients with osteoporosis.
Oh,
like if they have a pretty severe like bone degeneration, we'll try a specific kind of calcium. So it's interesting, the bones and the teeth are so correlated.
Yeah, because teeth are bone.
That makes
look
sense.
at the structure, like teeth are really bone. The only difference, so the top layer of the tooth is called enamel. Super mineralized, it's got no live cells. But underneath the dentin is literally the same collagen composition and calcium hydroxy, just like bone.
Wow, okay, so that makes sense. And then when you tell, so what kind of regimen would you tell women to have in these like couple of decades, above 40, 50, how can they protect their mouth against like inflammation and also preserve their teeth? Yeah, so I have really like 4 recommendations. Some of them are going to be topical, how to take care of teeth, and one is going to be ingestible. Okay, so we need to teeth rebuild also from within. And gums, we can't forget about the gums. And they need minerals, so a good healthy diet is important. If you're just using topical calcium hydroxide, but you're not really having a good intake of calcium, phosphorus, and phosphorus you can find a lot of times in organ meats. Maybe there's some plant-based things that have phosphorus. Organ meats have a lot of great minerals. It's hard to replenish on vegan, and we have a lot of vegan patients, then they have to kind of supplement. So from a topical perspective, I have 3, like a 3-step to optimum oral health. Brush using the calcium hydroxy, and I'm not, a big fan of electric brushes. If you want to use a manual brush, like I've seen a lot of patients that don't use electric toothbrushes well. Like they come in, I'm like, did you brush your teeth? Because I don't, it's like, so sometimes electric toothbrushes don't. Especially, they don't get everything, or maybe people don't hold it as close to the gums. We should really be brushing like 45 degrees into the gum. I see. Instead of just holding it flat. Is there like a time limit in terms of 30 seconds on the top, 30 seconds on the bottom? I mean, my recommendation is really use a manual brush. Small circles. If you want to use an electric, especially if you have dexterity issues, you have arthritis or something, you can, but then I would move it around. I wouldn't hold it just in one spot. Just get it around. Kind of like just slower, obviously. That sounds so obvious, but I see my kids just holding it in one spot. And I'm like, are you brushed your entire mouth? But they're probably busy doing something. Yes, looking at the phone. So brush with calcium hydroxyapatite. Secondly, use a water flosser or string floss. If you really, really love your string floss, by all means, keep using it. But a lot of people, what we find is like they're not really good about their technique with floss. So either I see floss cuts of people just kind of putting it straight up and down, and it cuts the gum. And that can create actually an opening in between the teeth where the gum gets receded. So you can actually induce gum recession with hard flossing. We'll have people who are like really determined flossing. And the other thing that I don't like about string floss, and I know it's interesting for you to hear a dentist who doesn't like string floss. You think everybody does there. There was a study that came out on Glide floss, and a lot of people love Glide floss. It's like such a popular brand. It is. Why? I don't know. Have you ever tried it? No. I tried it. It's great because it slides so easy. It glides in between the teeth. Hence the name. And it doesn't. Sometimes you get those floss threader, like it just like disintegrates. And they get floss stuck in like the last molar there. So Glide doesn't do that. That's pretty amazing. But it's coated with Teflon. What? Teflon? It's coated with Teflon. Oh, no, can't use that every day.
So they had a study on a group of women actually that was using Glide floss for 10 years. I don't know how they were able to do it.
That's impressive that they can follow that.
Yeah, and every single one, they had elevated levels of Teflon right after flossing
Wow.
in their
In
blood.
their blood.
In their
Hey,
blood.
ladies, please no using Glide.
No using Glide
Floss.
floss. And
And
it's
what do you
still
recommend?
available.
It's everywhere.
Yeah, but I think Teflon also on cookware. is
Yes,
still
it is.
available.
It's so available. I don't think we've really come there as a society to appreciate the fact that toxins can really mess up your hormones and mess up your neurotransmitters and shouldn't be part of our food or our, daily use of activities.
What does Teflon really do to the body?
Teflon is a toxin, and so for people who don't detoxify, so if your genetics don't really get rid of toxins, it can impact your neurotransmitters and your hormones, and it can also disrupt your gut microbiome by increasing inflammation. It really doesn't belong in our bodies.
Yeah.
Especially for those who can't get rid of it. Like a majority of us are pretty good at detoxifying, but 1/3 of us are not. And for those 1/3, when you have these toxins in your system, it increases inflammation, autoimmunity, pushes you quicker into perimenopause and menopause. So it's important to not have those things. So you say don't do the Glide.
No, so there's other healthier choices of floss out there. There's some natural silk ones that are coming back, and if you want to use waxed floss, just look what kind of wax it is. Some wax can be like petroleum based, and again, whenever your gums bleed, what's the thing with the mouth? Gums bleed, you end up getting whatever it is that you're putting there into the bloodstream, including bacteria. So if you have inflammation, and actually have patients that said, "Oh, I don't floss because
my gums bleed."
Yes.
Oh,
Yeah, and they just didn't want their gums to bleed. They really thought so my recommendation is use a water flosser.
That sounds pretty gentle. That's what I use.
Yeah.
Yeah.
It's just the safest in terms of, especially if you start something new, you haven't flossed in a while. Start on the lower power, and it'll actually, the pulsation. There was a study done on at USC, so a few years ago, where they have a centers for oral biofilm. 3-second pulsation with the water flosser removes 99.9% of plaque.
That's amazing.
Yes.
Just 3 seconds.
3 seconds.
Wow, that's good news.
So that's why I say, we have 28 teeth, most of us, because we're missing, unless you have the wisdom teeth, then you have 32. So if you do 3 seconds for each, that's like a minute and a half.
That's like not much in terms of self-care. I'm gonna have some patients at 3 seconds. You need to do that for your teeth.
Yes.
So water flossing. Okay, so I have some questions.
Oh, I forgot to say, so the other thing that because those are the 3 things, but the 4th thing is taking collagen supplementation. That's not just great for skin, but it's actually great for the gums.
Okay, that's so great. We have a genetic test that we measure here where people just can't make enough collagen, and so they're at risk for soft tissue injuries, probably have really poor oral health as well. So we really do encourage people to take collagen. Powder, pill, whatever form you can tolerate that's clean.
I have no idea you had a test.
Yes, it's a DNA life test where we actually measure all your genetics, but one whole section is about how can you make your own collagen, how do you process collagen. Yeah, and a lot of people actually don't, especially women. And then especially, you entering now perimenopause, menopause, where your testosterone naturally declines, and that doesn't have the protective impact on inflammation and on your ligaments. So your ligaments that were nice and flexible now become kind of stiff and hard. So all these women have like frozen shoulder, and they're like, why now? I just turned 45 or 47 or 55, but it's the lack of hormones that are doing that. And if they also have a collagen gene, a SNP, then it makes it doubly worse.
I see.
So I want to make sure we get to these questions. Are there serious dangers to having a root canal?
That's a great question, and I have to start with a story because I had a root canal, which I no longer have. So when I was
one.
I only had one because the second tooth that I actually lost, I refused to get a root canal. I just said to Dr. Diego, go ahead and remove it. I did not have a root canal because the first one, I had it at a young age. I was living in Romania at the time, and it was a big cavity because I was addicted to sweets when I was younger.
Who isn't?
So so the dentist there did it, and in Romania at the time we didn't have good root canal procedures. I had it redone here when I was in college, so I had that root canal since I was 14.
Oh wow.
And then I started flossing around, and I remember this was maybe when I was in my early, like maybe 10, 15 years ago, when it started to not smell good. And whenever I looked at the gum, it started to turn dark. So this is another part of your self-exam. If you have root canal teeth, kind of look to see what they're doing at the gum line.
Okay.
Look and see, are any of your teeth starting to turn gray, especially at the gum line? If you see that, that's not a good sign. The teeth have pores inside of them. So those pores can get filled with microbes. Same thing was happening to my tooth. That's why every time I flossed around it, I would get a smell. But on the CT scan, everything looked fine. But I told my friend, you know what? I don't have a good thing about this. I said, gotta get it out.
Wow.
Plus my
So you chose to just take it out instead of doing root canal.
Yeah.
Why?
I was getting heart palpitations, which was weird. I didn't know actually there was an association at the time. So, but any kind of oral infection can cause like heart palpitations. So I had it removed. I have an implant placed there now. And I started to feel better actually. After I had more energy, I didn't have any more heart palpitations.
What kind of implant did you get put in?
At the time it was titanium, because I didn't know about, we didn't have yet ceramic implants. Now we do. So we've had titanium implants since like the 80s, and ceramic implants, I think they came like beginning of the like 2010.
Yeah, I have a ceramic one you put in.
Yes.
I'm grateful for.
Yeah.
So what do you tell women who like, should I do a root canal?
So can root canals be dangerous? Yes, they can, because they can harbor bacteria that you don't see. The only way to diagnose them, and I encourage you, if you do have root canals, get a cone beam CT scan to evaluate the root canal.
Cone beam, okay.
It's a cone beam CT scan. It's the digital CT scan.
Okay.
So you don't get radiated, and then we can see, is there bacteria that's leaching? And how do we see this on a scan? We actually see darkening of the bone around the tooth base.
So you can tell.
Yeah, some women actually came and they had sinus issues. I had women that had root canal teeth that are in the sinuses. I constantly have chronic sinusitis.
Wow, I have a lot of patients who have that.
I took out the root canal treated teeth, and their sinusitis pretty much 90% better.
Wow.
Yeah. Also, like sometimes ear pain, or kind of like a diffuse pain. Like I remember I had this patient in her 60s. She had this premolar, and they diagnosed her with trigeminal neuralgia. I don't know if you know what that is. It's basically the trigeminal nerve. Oh my God, I'm in pain all the time.
Yeah, people have really sensitive.
I took out her root canal treated tooth.
Yeah.
Her trigeminal neuralgia went away in a week.
Wow.
And never came back.
That's amazing. It was all just that one tooth.
That one tooth.
Wow.
So the root canal teeth can be dangerous because they can cause these kind of, the bacteria. We believe they can travel up the nerve because they don't have their own nervous system. So they love electrical signaling because we believe they communicate within colonies, between colonies that way. So yeah, so like viruses also can generate these pains, so can bacteria. So
just taking them out of
them.
And then can anyone remove them, or should go to a biological dentist to be safe?
So actually, if you go to I have a podcast called the Holistic Dentistry Show, and when I go into depth about how to get a tooth removed, so that the area heals properly.
Yeah. Some
dentists are not trained enough. Yes, can they remove a tooth? Yes. But in terms of cleaning the bone, it's super important, and the periodontal ligament, because if we leave any of this bacteria in the ligament inside, now we get a cavitation.
Oh, the one we don't want.
The one we don't want, where microbes are stuck, because a lot of the microbes in the mouth don't need oxygen to survive. They can live there just fine. And especially some of them, like we have a Porphyromonas gingivalis that actually can stay within the jawbone, can travel to joints, so some people can get achy because of it. It's we call it a stealth organism, because the immune system doesn't see it. It becomes somehow invisible to the immune system.
That's scary, and it could be like a whole root cause for all kinds of autoimmune conditions or other things. So going to the right dentist is important.
Yeah, super important to have it removed properly. Also using ozone. I'm a big fan of ozone.
Yeah.
Ozone is basically 3 atoms of oxygen instead of 2. Oxygen is what we breathe.
And how do you apply it on the mouth? Is it through a spray? What do you do?
So we apply it in our water lines where we run ozonated water. We have you rinse with it. I apply it in the form of gas in combination with the oxygen. There's been research done, especially a lot of it coming from Europe and Cuba. on the power of ozone and oxygen,
Makes
what's the
sense.
right ratio.
Okay.
And actually, we need very little ozone to oxygen ratio
Mm.
in order to be effective.
Wow.
So that area is basically sterilized. And then we use something called PRF or
Can you
platelet
tell us a bit
fiber.
more about what that is?
Sure.
Yeah.
Like we actually draw blood and use
From the patient.
From the patient.
Yeah.
So we usually get like a vial or two.
Yeah.
For a tooth.
Right that day of the
That
procedure. Okay.
We extract the growth factors and fibrin.
Yeah.
And there's also immune cells there,
Yeah.
actually. And it becomes like a jelly. It literally looks like jello.
Hmm.
PRP is a liquid.
Right, because we do that here.
Yes.
Yeah.
And
What is
PRP, yes, PRF, it's a full clot because we
Okay.
want a full clot.
And then how do you apply it?
I actually stitch it inside
Wow.
so that it doesn't allow basically microbes to crawl in and infect the site.
Wow. And it's your own body's blood, so you won't react negatively.
Yeah, so sometimes, when I first finished my residency, I was doing more bone grafting because that's what's taught.
Yeah.
But what's interesting, some bone grafts, especially the bovine kind,
Yeah.
can trigger autoimmune
That makes
issues.
sense. It's not your tissue. Okay.
So I don't do, if I do bone graft, I always, is the patient's own bone. We usually can harvest it from somewhere, usually for
Yeah.
bigger, like car accidents or something like
Right.
that. Or it could be like a donor, like a gift from another human, we
Human.
call it.
That makes
But
sense.
I don't use animals.
Animals, yeah. No, that all, putting something else foreign in your body is like a big trigger for
Yeah.
autoimmune.
Mhm.
A few more questions. My mom, let me start with this one. Hi doctors, I have 4 cavitations and found some crazy things thriving there. They were in my wisdom sites. My daughter, who's 19, developed TMJ due to my sickness. You mentioned TMJ as a potential cavitation. Does TMJ and age matter? Is there a relation between TMJ and cavitations?
TMJ can actually be triggered when wisdom teeth are removed.
Oh.
You're mentioning wisdom teeth in there. So that's typically when we see it. The reason is either patient is asleep and they're opened a little bit too big, or maybe the doctor, when we're trying to get the tooth out, it luxated the jaw ligaments.
Okay.
So my recommendation is either some adjustment from the chiropractor after wisdom tooth removal. And if the pain persists in the joint, definitely there's another CT scan of the joint itself to see what the disc is doing. Was there damage done to the disc? Is it tendonitis? Because then we have different injections that we can do to help regenerate. Like peptide injections and ozone to help or PRP.
Let's see. My mom's 57 and already lost most of her top teeth. We're trying to figure out what the cause is. Is that normal for menopause? Would you say it's normal to lose so many teeth?
No, it's not normal to lose. So my guess is, if she lost all her top teeth, it's probably due to periodontal disease. So my recommendation is, if your dentist, if you've had a deep cleaning, just make sure you stay on top of it. If you have gum disease, we have much better ways to treat it today. So for example, in the past, when I was a resident at UCLA, the way we used to treat it is like, okay, you first get your deep cleaning, 6 weeks later, if the pockets are not resolved, we get surgery. But nowadays I do an oral microbiome reset. It's not surgical. We do a saliva test.
Yeah, what do you find in the saliva test?
We look for 11 different pathogens that might cause disease.
Okay.
And we look at the different levels.
Okay.
And we also check for IL-6.
Okay.
Because if it's high, genetically predisposed as high, then we know they're gonna get more bone loss. So we need to know that information so we can gear how often you should come in for us to do a cleaning.
That makes sense. Interleukin-6 is something that's super common. People who have issues with that can react to infections and other things much higher than people who don't.
Yeah, so it's an important thing for us to know. So
Yeah.
I mean, it's not common for dentists to check for IL-6, just so you know. This is like, but
it's deep dentistry. It's like why? And then tying back to menopause, as you're losing that estrogen, especially if your mom's not on hormones, your estrogen really does control your immune system and controls your inflammatory response. So if estrogen is very low, then she can have more inflammation in general.
Yeah.
So that's probably kind of tight. But that's so hard to lost all your teeth.
Yeah, the good news is there's good techniques like ceramic dental implants that we can actually place, let's say 4 or 5 implants and put a whole row of teeth the same day.
We have a mutual patient and she lost all her teeth and you did her entire mouth. and her mouth looks amazing.
I just saw her actually a couple days ago. I tweeted her,
Wow.
I want to say maybe 4 years ago.
And that was amazing.
Yeah,
She
yeah,
looks like
she's-
10 years younger too, because
yeah.
her mouth's like sparkling.
Yeah.
Yeah, so that's
we
really,
ended
that's
up doing
beautiful.
implants for top and bottom with her, but she ended up losing, and actually also from gum disease.
Mm.
So, if your mom lost all her upper teeth, let's make sure the lower are still there.
Mm.
And definitely it's a good time, we have to look at her, osteoporosis, to see how
Yeah.
her jawbone quality is, and
To think about
dental implants is a great option
Hmm.
to maintain the jawbone so that it doesn't dissolve. So it goes
That
away
makes
with the
sense.
denture.
Okay, one more question. I always have terribly sensitive teeth. It takes about 4 Novocaine shots for me to deaden before procedures. I recently had 2 root canals and still have pain with those 2 teeth. What can be causing it if there are no nerves there? I'm 53 in active menopause and have 4 or 5 autoimmune diseases starting at age 5. So she's like the perfect setup.
Yeah, so
Have
it's
sensitive
interesting
teeth.
that the sensitivity, it could be because of dry mouth, like we were mentioning earlier. So my recommendation is definitely a chewable probiotic and the calcium hydroxyapatite. That's just to the chewable probiotics also help to stimulate saliva. And the Orasana chewable probiotics that I formulated, they're vegan certified.
Okay, great.
And it just basically protects against cavities. We have studies that they do that.
Okay.
And also it helps to stimulate saliva just by letting it dissolve in the mouth.
Mm.
But also with quite a few autoimmune issues, my recommendation is get rid of your root canals.
Wow.
Because especially if they're symptomatic, your body's trying to tell you something. I always say pay attention, to the signs that your body's giving you. And unfortunately, I have many patients that come in and say, my dentist said my root canals are fine, even though they're hurting me.
Oh, that's so devastating to hear as a patient.
Yes.
Yeah.
And they're not okay. So if you haven't had a cone beam CT scan to evaluate the root canals, I would say definitely do that to see if there's inflammation around them. If there's inflammation and the root canals already been done and they've been done well,
yeah,
but that means your body's just not responding well. And we do this biocompatibility test.
Okay.
For people that have a lot of sensitivities.
Okay.
Almost 100% of the time, the material that's used inside the root canal, it is not compatible with the human body.
Oh my gosh, and we're using it anyway.
Yeah, we're using it because nobody tests for it.
Wow.
It's not the norm yet.
That's so unfortunate.
It is.
Wow.
It's
So
called
you
gutta
test.
It's actually a cork coming from a tree.
Oh wow.
It's a cork material.
Jeez.
And nobody responds well to it. Almost nobody.
That's so disturbing.
Yeah,
And
there's
there's
a lot of root canals being done.
And that's conventional dentistry.
That's conventional dentistry. There's only a couple maybe endodontists in the whole United States that actually use a cement paste. They don't use the gutta percha at all.
Okay.
It's actually much better in terms of allergy and responding to it. So I think
that's disturbing. And if you already have 4 or 5 autoimmune processes, definitely work with a functional medicine doctor to see what's going on and why is your body triggering this, because you're going to just keep collecting more so you can reverse that. What is the tooth powder?
One other thing that we found really interesting with tooth sensitivity.
Yeah.
I've had a couple of patients with severe sensitivity to cold. Ozonated water rinses.
Oh.
Ozone.
And they do this at home?
Yes. Okay. There's actually these little tumblers that we have in our office. And if you're local, you don't have to be a patient to purchase like a product from us. But ozonated tumblers, you might be able to also find them online.
Yeah.
Just swish with this for like 1 minute twice a day, and we found a significant decrease in tooth sensitivity.
Wow.
We think it has to do because it cleans the plaque from the little tubules of the teeth. So
decreases inflammation, takes out microbes. Does it taste different, the ozonated water?
To me, it tastes like rainwater.
Okay.
It tastes like
that's really good.
Yeah.
That's a great hack. Yeah. And then what's the tooth powder? We'll put it in the chat from Orasana. And my dentist recently prescribed a 1.1% sodium fluoride toothpaste. What do you think of that?
Well, I feel, and from the studies we have, calcium hydroxyapatite works better than fluoride. I'm not a big fan of fluoride because if you end up ingesting it, it's toxic. I mean, we use fluoride in the fields as a pesticide. And there's a great documentary actually called Fluoride Gate.
Oh, Fluoride Gate. Yes, I've heard of it.
Yeah. it explains how fluoride ended up in the water here. And actually, for those of you who might not know, finally, the EPA admitted that we should have no fluoride in the water because there's no safe level of fluoride in the water.
That's wild. And we've been doing it for so long.
My association, the IOMT, actually has hired an attorney for years now to fight this because we have so much research on how fluoride is toxic. And finally, they agreed it shouldn't be in the water. Now, getting it out of the water is probably going to take another few years.
And in terms of actually having safe water. Wow.
So I'm again, it's what it's taught in dental school though, the fluoride.
Still.
Yeah.
Can you fix teeth by remineralizing them with remineralizing gum or foods?
You can remineralize teeth as long as your teeth are alive and they don't have root canals. They can grow mineral if they just need the right environment. So especially even cavities can heal. Teeth can heal. Cavities is just a sign of imbalance where you actually have too much acid in the mouth, and what causes acid is the microbiome. We actually also do a saliva test for kids, you know, or people with dry mouth that all of a sudden have a bunch of cavities.
Yeah.
And then we try to lower the specific bacteria first, and using ozone.
Okay.
Yeah.
Great. So not antibiotics.
No.
Nothing like that.
Ozone.
Great.
Using ozone. Then we make these mineralizing trays that you can actually put like the powder in it, and then you put the tray on, so it holds the powder, the calcium hydroxide on the teeth.
Nice.
Yeah, so that'll help to mineralize. So yes, you can mineralize teeth and also reverse cavities.
Right. And then, what is the last word of the nano calcium hydroxy apatite, right? What is it?
Yes.
Hydroxy. It's apatite. Then, question about if UCLA has a cone beam scan, why is any of this not covered or available to members? I had to pay out of pocket for most of my biological work, not insurance. Any thoughts on that?
Yeah.
I get the same questions about functional medicine.
Yeah.
It's so frustrating for patients when I hear them.
Yes, no, I completely understand. And that's true. Why doesn't UCLA cover it? You know, if they have it.
Conventional dentistry.
You have to look at the insurances as a business.
Yeah.
They are a business. They get money from you as clients.
Right.
But the more money they keep, the more profitable they are.
Please
So
don't do tests, don't do things.
They're not about doing the right thing, because a lot of patients come, I'm just gonna do whatever my insurance covers, but insurance is not your best friend.
No.
So
and what's to cover the bare minimum?
I heard, like, we had this one patient, she was working for an insurance company, and she was mentioning that every 5th claim she had to put it in the trash and pretend they never got it. Jeez.
I believe that.
Yeah, it's
that's
sad
so
that
unfortunate.
happens.
Yeah, so and then insurance is really more, you need insurance, like you need car insurance, you need your house insurance, but you don't rely on that for your oil changes to make sure things are running smoothly, or if you have a broken lock. It is frustrating though, given how much we pay for insurance. Yeah,
so we try at our office to even take photos. I have to write a detailed narrative. So we try to help as much as we can, even with biological codes. We've had, like, obviously extractions and dental implants, depending on your plan, those get covered, and crowns and things like that. But things like ozone might not get covered. But then again, ozone is not that expensive. I think it's totally worth.
Yeah, that sounds like, and it's not harmful and easy to use.
Yeah, even like if you're gonna remove your mercury, sometimes insurance would love to deny those claims. So now photos are super important. So if you're gonna go to a biological dental office, just make sure they take photos to submit photos and x-rays to the insurance.
Is that effective in getting something covered?
Yeah, because you can see if something has a cavity on a photo, and x-rays, as I was saying, only show 52% of the problem.
So you can see
is good for insurance purposes because they don't want to pay.
Makes total sense.
Yeah.
And then one person asked, how do you get rid of a root canal? Again, maybe you could refer back to your podcast.
Yeah, I think so. So basically how we get rid of a root canal depends if it's a front tooth or a back tooth and how infected it is. Typically back teeth, I like to take out each root at a time. So it's all together, but it just puts less stress on the bone. So we always think, everything's alive. So we want to keep everything happy. Once a root canal is removed, I use something called a piezoelectric device. It's basically an ultrasonic tip that cleans out the area without creating heat, because heat is damaging.
Okay.
Then ozone gas, PRF, And then I put usually a little bit of a tent over the top. It's called guided wound healing
Oh, nice.
to help prevent food from getting stuck inside.
And do you usually recommend antibiotics before all
No.
these procedures? No.
Because of ozone.
Oh, that really helps.
It really helps. So whenever
Much
I do
safer.
removals of teeth that are infected, no antibiotics are needed.
That's huge.
Yeah.
And then how do you feel about oil pulling?
Great question. Oil pulling has been around for thousands of years, since Ayurvedic times.
Yep.
And I actually had to give an interview about this, so I did some research on, let's see what's available.
What does it do?
So I found a couple of research papers from Indian universities, and it helps with gingivitis.
Okay.
So that's good. And why? Because it was actually traditionally sesame oil was used because nothing was cheap and available.
Yeah, available.
Today, there's more like coconut-based oils on the market. And the thing with the oils, if you swish them back and forth in between the teeth for 20 minutes, which is the right way to oil pull.
20 minutes?
At least 20.
My patients be like, I don't have time for 20 minutes.
I don't have time for
Yeah, I know, but still, it's important.
It'll turn into a soap.
Wow.
That's what this, so you gotta that swish. My grandfather actually used to make soap out of oils.
Oh,
Really good soap.
fascinating.
Yeah, so that's what happens. It becomes a soap-like fluid that cleans plaque.
Okay.
But the research that I saw it shows that it only goes about 1 millimeter under the gum. So I think if you're using a water flosser, you could not with the oil, but just with water, you can finish in 2 minutes, be more effective versus oil pulling for 20.
Right.
So and also I found a couple of cases where patients inhaled the oil droplets in their lungs and they got an infection.
Yes, that was pneumonitis.
Right.
Yes.
So
careful.
there was that. For our patients that have gum disease, we actually have an ozonated oil.
Okay.
That we use, but you don't have to swish for 20 minutes because we're not counting on the soap effect. We're counting on the ozone to do the work.
Okay.
So we're just having patients swish for 1 minute and it's very effective.
That's the ozone is like a game changer. Where do people even get that? They can get it from your office.
They can get it from our office. Air One sells some of our products.
Okay, great.
And on Amazon, some of them, and or orasana.com. Yeah.
Perfect. Thanks, Alyssa, for adding that link. I see here. And then one patient asked, I'm using a calcium hydroxyapatite toothpaste. Is it also safe to use the mineralizing powder? And is there a risk to using too much hydroxyapatite? Yeah,
there's no risk for that. So I have lots of patients that, love their toothpaste. And I always say, okay, that's fine. Just sprinkle some of the powder over your toothpaste that you love. Yeah. Then you can combine the two. Or just you can brush and then just apply the powder as a treatment. Okay. And just leave it on your teeth because it's got the probiotics, it's got the calcium hydroxide. Oh, just overnight. Overnight. Great. Yeah, and you can leave it overnight. Because the mouth is the driest at night and it really stays on there. That's amazing. When you're talking about using appliances at night, I have clenching, which I discovered, at your office, and using the mouth guard has been so effective, especially because you can personalize it to the mouth. Can you explain how you do that? I saw your little printing device. I just thought it was so kind of fascinating. Yeah. Oh, I'm glad you brought that up because I was just talking to somebody about the type of material that we make the mic are. So make sure you ask your dentist, make sure they're BPA free. Yes, please. I don't need toxins. I don't detoxify well anyway. Yeah. So BPA, bisphenol A, it's an estrogen-like modulator. So you do not want that. What happens when you grind, and especially in a warm environment, BPA kind of comes off the surface, yeah. So the BPA free and night guards essentially do a couple of things. I think they're a really good insurance for teeth, especially if you're clenching and your mouth is drier. Now you're, even more so damaging teeth. And also it helps with the TMJ. So at night, when we open up the jaw a little, it leaves more room here. So things can oxygenate, rejuvenate, and get more blood flow. A lot of my patients in these like perimenopause, menopause decades are like taking care of their parents. Their kids are leaving. They're taking care of their kids. They're working hard. It's the peaks of their careers. And there's so much stress. And a lot of them, I think, don't even realize that they are clenching and grinding at night. How can you tell that you are? Like, I didn't realize until you told me, or one of your dentists told me. Yeah, Dr. Diego. Yes, Dr. Diego was like, hey, do you know you're clenching? I was like, really? But the mouth guard really helps. I do feel relaxed.
So how would a
Yeah.
patient be able to tell?
Yeah.
They have to go to the dentist to ask if they're clenching?
That's a great question. No, when you wake up in the morning,
Yeah.
just yawn and feel on the side of the face. If you feel
Mm.
tightness here, or if you open and close, actually have a little popping on the side, and you're feeling a little popping on the side of your ears, it means your joint there is getting a little suppressed.
Oh, wow.
So usually I could tell in the morning when I'm clenching, you know, because this right here gets really tight. Yeah.
So that's where you could have clenching.
Uh-huh.
And then do you have a printer in your office? Because it fits so snug to my teeth and it doesn't cover the front.
Yeah.
So how do you actually make it for patients?
Yeah, so we've changed a lot. Like a lot of them used to be so uncomfortable. People didn't
Yes, I
wear-
couldn't imagine being compliant if they didn't fit well.
Yeah, and we do digital impressions now and 3D printing. So the design is like we keep the front teeth open so that you can, it just doesn't feel so bulky. And another, I work with a couple osteopaths and I learned from them not to ever make an upper night guard because it locks the cranial mechanism. So from here up, we have like a midline suture where the bones interlock like this. So as we breathe, there's a micro movement.
Okay.
But the lower jaw is a full jaw. It doesn't have that. So a lot of people, the reason why they don't feel comfortable with an upper guard is because it locks the breathing and the movement of energy. So people's like, oh my God, I get anxiety. And actually, even I had patients that we had to put a bridge across and they couldn't tolerate it.
Interesting, because mine doesn't have anything. It's like empty.
Yes, and yours is alone.
Yes.
But the upper, usually any kind of crossing over this midline, a lot of people can't tolerate it because of this cranial movement.
Can they tolerate other devices?
Or
Or just they have to
lower,
try to knock
yeah.
lower
Exactly,
ones. So
just
that's
make
where you
lower.
focus on the lower. Oh,
Always.
good to know. Great.
Yeah.
Then what do you put to fill the space after you remove the root canal? And is it permanent? Lots of root canal questions.
Yeah, so after we remove the root canal, we put the PRF and the little guided wound healing. So typically within 4 to 6 months, it heals. Your bone cells know what to do. All I'm doing is creating an environment so your bone grows in. So the bone cells crawl in about 1 millimeter a day till the space is filled, usually about maybe 3 months, and then mineralization occurs. That mineralization, depending on where you are, now if you're postmenopausal, it's slower. If you have the more testosterone, you have the better bone we get.
Makes total sense.
Right? So, and then usually it could take up to 2 years, the mineralization process, but typically we have enough bone at 4 to 6 months to place an implant.
Okay. Okay. And how do you feel about using red light therapy for the teeth and gums?
I love red light.
Okay.
We use it for healing in our office. TMJ pain is great for that, especially for pain, but also I wouldn't use blue light. I know there's some companies out there that are selling blue light. Blue light can be like disturbing the DNA, like UV light type thing. So I would say, So plus blue light also disturbs the sleeping cycle, especially to use it at night. Any kind of blue light is just not advisable. So red light, totally great. It's anti-inflammatory, anti-aging.
I'm a big fan of it as well. Then somebody wants a link to the ozonated tumbler, and maybe we could when we send a copy of the webinar, we could send some of these links in there so people could have them. Is it bad to have upper mouth guard? And do most regular dentists have access to BPA-free mouth guards? I guess you have to ask.
You have to ask, and if you know what we find is like a lot of dental offices, they're not exactly sure what's in the material, because it's this trust that everything that's on the market is okay to buy, but we find that that's not the case.
Right.
You have to ask, like even in terms of fillings, like white fillings. There's a lot of white fillings with BPA in it. So you just have to ask the dentist, are your fillings BPA free? They should be. I mean, we have great fillings nowadays from the dental suppliers, Europeans. Germany is one of the ones that have really, really good biocompatible materials. As I was mentioning, this biocompatibility tests about 600 to 700 different dental materials. And a lot of them are not satisfactory for that particular patient. So they are, after all, man-made. They're synthetic. So everybody's body is different. So
and that's so important. Even when we're thinking of like hormone replacement therapy for women, we really are thinking like, what is your body and can it tolerate these hormones? Is your liver able to process tomorrow's hormonal dose? And so much of it is dependent on, like, do you have toxins in your body? And the number one toxin we see in our patients is mercury. And sometimes it's from amalgam fillings, and sometimes it's from, we're in LA, it's all about the sushi they're eating. But and we don't want them to have that mercury because the mercury mimics estrogen. So as we're giving them their hormones, they have too much estrogen, and that can cause inflammatory issues. How do you remove mercury fillings or amalgam fillings? And is it important to see a biological dentist as opposed to a conventional one? What's the difference?
Yeah, great question, and we haven't got a chance to talk about
that.
I had 16 large mercury fillings in my mouth, so 16. I know 16, and they were huge. I remember taking this fork and touching it on one of my mercury fillings, and it would give me a zinger.
Jeez.
Electrical current. So if you have metal against metal in the mouth, in a wet environment, it creates a battery, and that battery steals energy force from you. Life force.
Wow.
So. You know, that's why metal against metal, definitely not advised. How do you know you have mercury fillings? If you look in the mouth, you do your self-exam and you see gray, silver, it's usually mercury, 50%.
Wow.
You can also, if you have old crowns that are 20 years old, a lot of times dentists would leave mercury underneath the crowns.
Wow.
So they could also exist underneath old crowns.
Okay.
I see
so
sometimes.
So sometimes when I'm seeing like white on the, I'm not a dentist, I'm looking at the mouth, I'm like, oh, they don't have any amalgam fillings, but we don't know. Me and the patient doesn't know.
Yeah, you can also ask, do you have old crowns?
Oh, so that's how you know.
Yes.
And then send them.
There's
you
a
guys could see
potential.
them on CT scans?
Unfortunately not.
Oh, so how do you, can you
By
tell?
removing the crown.
Oh,
But usually if they're 20 years old,
you know,
they're leaking somewhere, you know, they're not the safest.
Oh, I didn't realize that, because sometimes it just looks white, and I'm like, oh, I don't think you do.
What is an unusual place where I find mercury is in the gum.
In the gum?
In the gum. We call them mercury tattoos. And it's from when the
wow.
mercury was placed. That this band used to be around the tooth, and the dentist would just pack it. And then somehow it would wedge under the gum, and it stays there, and it actually migrates under the tissues.
Oh, that's how measuring it in the blood.
That's right. And you could see from the outside that the gum is bluish.
Ozone?
I cut out the gum.
Oh, wow.
And usually when I cut it open, there's tons of mercury under it, because it's just showing me the bluish tint on the outside. But underneath, usually there's more, and I just take them out.
Scary.
Yeah, I've had one patient who actually had a lot of mercury just in the front here. She actually ended up with the skin cancer right on the outside of her chin.
Jeez, right then.
Yeah.
Wow, that's super scary. And do you recommend at all bonding over grafting? And my general dentist recommended it and said it was more permanent, as grafting may not take.
So the problem with the recession and putting bonding on it is like, when we put bonding on there, the gum now goes away even more.
Oh.
So you're just putting a band-aid on the problem. If your gums are receding, usually it's because they're thin and they're going to continue to recede. So I wouldn't say yes, it's a permanent fillings, if you would say that, but every 5 years, typically we need to replace these fillings. Because at that area of the tooth, the tooth flexes. So it's a lot more prone to chipping and leakage.
That makes sense.
So usually about every 5 years. So I wouldn't say it's permanent. I always like to repair the defect that was there with the same kind of tissue. So if your gums receded, let's work on the gums. The other problem with fillings is once you cut into a tooth to put a filling, now you're going to replace that filling every time is more of an injury to the nerve.
Oh.
So you might end up actually with a root canal. Or sensitivity. So I don't think fillings are a good way to treat recession. If recession is 1 to 2 millimeters, don't treat it. We actually observe that. We don't treat every recession.
What do you wait for? How much before you do something?
We usually, it's 3 millimeters or more, and usually the quality, if the gum is like bouncy and very, very thin, then we'll do something about it.
Okay. Right.
Yeah, but fillings, I would say they only make the situation worse.
That makes sense. We've already come to an hour. I know that's hard to believe, but I think we did answer everybody's questions. And then a few people asked about our practice and where we where we practice. So if you could just put that slide up for me, Alyssa, just with that, the QR codes, if you guys do want to come and see us, functional medicine or holistic biologic dentistry, that's a QR code. And you have something you want to offer this audience.
Oh, yeah, I was talking to Dr. Sayana right before this. I'm like, what can we offer? So we're gonna offer, if anybody's interested in coming to visit us and get an opinion, we're gonna offer a complimentary consultation up until April 10th. And I'm gonna message my front desk.
Yeah, you better tell them.
Because we just decided this.
Yeah. And that is very team. I mean, most of you on here already are our patients, and if you guys want functional medicine, please come and see us. The QR code is on there. But yeah, I do think it's so important, especially women in these decades to put everybody else first. And it's important to put yourself first and really start with your mouth.
And one thing I love about you, the way you treat patients, and my husband and I are both patients here, is like you're such a good detective.
Yes,
because there's a million things sometimes happening. The house can have its own problems with EMFs and mold and things, gut issues, the mouth. But you have such a good way of kind of sequencing everything so that everything's done at the right time.
And you just have to have a very clear protocol so you don't miss anything. But and functional medicine is just it's given myself and all my family and patients just like their life again. And it's so important to look deeper and find a dentist who's going to look deeper and just advocate for yourselves. If somebody isn't the right person on your team, change it around. So we'll be sure to send this webinar to everyone. Use the QR code. Make sure you mention the Sayana webinar so that people at Dr. Moldovan's office can see you for that complimentary consultation. And then we do have a raffle for somebody to get one of my favorite products. I feel women in their perimenopause, menopause decade need, and that's Relora. And it's a supplement that's magnolia bark. It just helps you decrease your stress levels. And it does help a lot of people with TMJ, with clenching, but it's, all of us are so unconscious of our stress. And I think you already found the winner, and it's going to be Liana Bacon Burns. So you're going to get the Relora, and we will ship it to you. It's very safe to take. Take 1 or 2 pills at night or during the day. It may cause sleepiness, so try it at nighttime, but you should just feel more relaxed. Okay, I hope you enjoy it. And if you guys have any questions, feel free to contact our offices. Thank you so much, Sanda, for being here. And I really appreciate you taking the time.
Anytime.
Take care, you guys.
Bye, everyone.
Bye-bye. See you.